project is a community food program. It's part of Kalihi Valley's Health Center, and it's a really unique program because we're not just doing a nutrition program or teaching people how to cook, but we're connected with the nature park that the health center manages in Kalihi Valley. So it's a way to connect people to the land, to each other through food, through connections to culture, through the ways that we share traditions, share recipes, just get to know each other and break down some of those barriers and isolation that can be a risk factor towards good health in the community. And in doing that, focus on the strengths that we have as a community and the ways that we come together and learn from each other. We're always coming together to cook, to bring people to the land, to garden, and do that in different ways. Often it involves a cultural component, whether it's talking about Hawaiian culture or sharing Hawaiian cultural practices or making cultural connections across different cultures. Most people in Hawaii are familiar with imu, which is an underground earth oven that is made for big community gatherings, sometimes luau or cultural celebration, and it's basically cooking a lot of food underground, traditional food, sweet potato, pig, things like that. And one of the activities that we've done in this project is what's called an which is similar to an imu, which people in Hawaii are familiar with, but it's a Micronesian version of this, coming from the island of Chu. And it's something that we wanted to do with the Micronesian and Chukis community because they're very strongly represented in Kalihi and in Kalihi Valley, but there's not a lot of opportunity to continue those land-based practices that they used to have. A lot of people don't have access to the rocks, the wood, some of the traditional foods. So we were able to work with some community leaders, some elders from that community to recreate that process of doing that community feast. There were 9 different island nations represented, something that some of the leaders from the community told us had never happened before here in Hawaii, that people from Palau, from Chuuk, from Marshall Islands, from other places had all come together at one place. One of the risk factors for good health is isolation. And when we talk about isolation, that could be loneliness, disconnection from doctor, disconnection from land, from culture. And when you're able to break down some of those barriers and people have that sense of wholeness and who they are, knowing themselves, being able to tell their stories, practice their traditions, pass culture down to younger generations, make the food their grandmother used to make when they were young, things like that, people feel a sense of self that puts them in charge of their health care. And we're looking for good health outcomes, but only a little piece of that is going to the doctor and having a relationship with your doctor. It's also having that relationship with yourself, with your community, with your neighbors, and being able to come together and share things and feel in charge of your health.